This news story was produced by Cogeco North Bay News. To watch the full newscast, tune into channels 12 or 700 live at 5:30 p.m. Monday to Friday.
Topic and what is missing or not working, and how could it be fixed?
Close to 30 members of the public had their say on the province's dementia strategy on Thursday night at the Golden Age Club. After the facts were clarified, the tables worked together to identify key areas that need to be addressed moving forward to care for those afflicted with a mental disorder. Tammy Bellamy is one of the nearly 230,000 Ontarians who live with dementia. She and her husband John traveled from Sudbury to ensure their voices were heard.
To change the stigma of dementia, that now earlier and earlier people are getting diagnosed from dementia, and I wanted to know what the strategy is for the government to change and make changes for all of us. I'm living with Lewy body dementia. I have early onset, and it's changed my life completely from losing my driver's license and my work to everyday life, needing care through CCAC, changing the face of dementia. I've had a lot of changes, and the perception before was the older person. Now it's the younger people are getting it.
Caitlin Vieux is a project coordinator for Behavioral Supports Ontario. Her piece to the dementia healthcare puzzle focuses on flexibility.
Flexibility is a key word, I think, in all of this. Flexibility so that healthcare providers can provide care to the patients that they're supporting, no matter where they live, so whether they are in long-term care, in their homes, or in acute care, or transitioning anywhere in between, so that healthcare providers can really, and all of them, including personal support workers, nurses, and other allied healthcare staff, can across all the sectors.
Did you find this activity? It's the second of 5 communities in Ontario. Did you find this was beneficial?
Absolutely, and I think all of the material that the ministry put together was very, very comprehensive, yet very easy to understand. So I think it really allowed everyone who was here today to contribute what they had to offer.
Michelle LaCourse works in a long-term care home locally, and she sees how dementia affects those diagnosed on a day-to-day basis.
I directly interact with people with dementia, and I think it's important for somebody to speak up for these people and to make sure that their best interests are heard and that they get the best possible care, the best quality of life. Tonight was great because everybody here is working from a different point of view, but all for the same purpose, and it's great to see that.
You may recognize this gentleman. Yes, that is Scott Todd, Deputy Police Chief in North Bay, but he was not here representing the service. A member of his family is afflicted with dementia, and he brought forward the significance that technology will play in caring for those who suffer from the disease.
I know from personal experiences in the family where an individual is diagnosed with dementia, one of the first things we were involved in was the decision of a driver's license. And taking the driver's license away restricts freedom. It also causes an increased pressure on caregivers and family to fill in when the issue is needs for transportation for medical appointments or for groceries or food, and that causes increased stress on families. So the whole aspect of the autonomous vehicle, is that an option that we can have for dementia people in the early stages of dementia? Can we provide autonomous vehicles for those people, or can we have an opportunity for industry to provide autonomous vehicles for those people so they can get to appointments, they can go grocery shopping even though they may not have a driver's license?
The provincial dementia strategy is expected to be released in 2017. If you are interested in watching Cogeco North Bay News, you can become a subscriber by calling 1-800-267-9000.